everyone, my name is Clancy and I'm a lecturer in speech pathology, and in this video I'm going to talk about a role of a speech pathologist. So a speech pathologist, otherwise known as a speech language pathologist or a speech therapist, depending on our workplace context, is someone who prevents, assesses, diagnoses or treats communication and swallowing disorders. So they can be things like speech, understanding language, using language, social skills, literacy, including reading and writing, as well as stuttering or fluency and using our voice. So speech pathologists can work across the lifespan, so we can work with young infants all the way through to adults, including working in palliative care in hospitals. In the paediatric population, we can work with a range of people. These might include those with developmental disabilities, such as autism spectrum disorder, cerebral palsy, Down syndrome. We can work with children who have traumatic brain injuries, children who have hearing loss, and then a lot of children who just have developmental communication difficulties, meaning that they have speech and language difficulties that have no known cause. So we can work in a range of different situations. You'll find in the paediatric population, a lot of speech pathologists might work in early intervention services. So they're services that target children in that 0 to 5 year age mark. In Queensland, Department of Education and Training, so the Education Department, employs speech pathologists to work in schools. A large number of speech pathologists now work in private practices. We have those therapists who work in the hospital setting. There are a range of other healthcare providers that speech pathologists work for, including not-for-profit organisations. So organisations such as the Cerebral Palsy League or Autism Queensland are not-for-profit organisations. You'll find that speech pathologists work a lot under the National Disability Insurance Scheme as well, particularly in the paediatric population, and most of those therapists work for either not-for-profit organisations or private practices. In our paediatric population, the main areas that we treat are speech, which is the difficulties producing the sounds to make words. So if a child was saying wed instead of red because they didn't have that R sound, that would be a speech difficulty. We work with children who have difficulties in language. Now, language we split into receptive language, which is understanding language that's being used, as well as expressive language, which is our ability to use language to convey ideas and information. Within language, we also support children within the domain of literacy, so their reading and writing skills. We also work in an area called dysphagia, which is swallowing. So children might have difficulty swallowing food or liquids. This includes very young children, so we often work with infants and babies who might have feeding and swallowing difficulties. We also work in an area called voice, which is where we look at someone's voice quality, pitch, and loudness. Now, more commonly, this will be with adults. However, you do get children who might have voice difficulties and require some early intervention. We also work in the area called fluency, otherwise known as stuttering. Okay, so that's when someone has difficulties producing smooth speech. And finally, we have multimodal communication. So when someone doesn't have the sufficient verbal language to meet their daily needs, a speech pathologist can provide an augmentative, meaning alongside speech, or alternative, meaning instead of speech, communication system, and therefore people which we would term having complex communication needs. So that's where you see speech pathologists prescribe things like picture boards. We might have an iPad that has a voice output device, and we feature map those systems. So we work out the language needs and capabilities of that individual, and we match a system that will suit them best. And we often do that alongside occupational therapists who help us with the access to those systems. So that's just a bit of a summary of the role of a speech pathologist. I hope you learn a lot more about our role in the paediatric population as part of this IPE unit.